Eastern medicine has a very long history. In the past, it has been passed down from generation to generation, whether it's in the written form or by word of mouth or within the family. So they don't have the same kind of level of testing like they have in the Western medicine. In the past, Western medicine view it as a very skeptical phenomena because they don't have the same tests that you can assess for the effectiveness of the Eastern medicine. But nowadays it's not true because the Eastern medicine can go through exactly the same rigorous testing that the Western medicine have because of the advanced technology. For example, Eastern drugs, we can actually isolate them, extract them, and look for the active ingredients with the technology we have, exactly like for Western medicine. And then you can go through the same rigorous testing in cell culture models, animal models, and even in clinical trials. So now Eastern medicine has been recognized as effective in a lot of the different treatments. In the Western medicine, if something goes wrong, you just cut it off, right? Every part of our body has a specific function. The organs just don't function independently because they function as a coherent part of the whole body. So they are there for a purpose, right? So you cannot just cut off one thing and then, hope for the best and then, trying to pump medicine into it and then hopefully it will do the job. It doesn't work that way because everything is integrated. The Eastern approach is that they would always treat the body as a whole. And they also believe in that the body actually have a lot of self-healing power, which is actually very true because we have a very good immune system. We are able to heal ourselves. And that doesn't mean that the Western medicine is useless because Western medicine, because of its advanced treatment, the diagnosis, the technology is so good. So the two actually complement each other very well. And I think Jaseng has the right formula in terms of their approach to this holistic treatment, especially in spinal injury, because you can actually see, with X-ray, with MRI, with CT, how looking at the bone degeneration, what regions there were the slip disc, and looking at some of the soft tissues that were affected. So that actually helps the diagnosis much better. So then you can specifically target the area of degeneration. So in this case, with the Jaseng treatment, where you would put the acupuncture needle to release the muscle tension, and the medicine that the patient is being prescribed would help the bone or the disc recovery, for example, because these are a lot of the time are chronic diseases, so they need prolonged treatment. So then after 6 months, for example, that the patient treated, then you can go back and have to retake your MRI, and then you can compare to see how much the patient has improved. So there's no reason why Eastern and Western medicine could not complement each other and work together in giving the best treatment to the patient. And I think this is the way the future is heading.